Both risk and crisis management are critically important. However, especially in the medical field, unlike risk management, crisis management has not been paid attention, especially in catastrophic neurological disease like acute coma. Today, I'd like to present about the crisis management of acute coma at the onset. Risk management starts from mitigation and prevention, goes to preparedness, prediction and early warning of the disaster. On the other hand, crisis management starts from impact assessment, response, recovery, and reconstruction. Crisis management is often expressed as damage control. That is, that decreases the damage after the event. This slide shows simulation-based education in medical safety. Team steps is well known as the education of the risk management. Also, RRS, rapid response system, is also well known. This is a kind of crisis management just after the insult or the event. PAM, post-accidental response management, was developed by us about 10 years ago and very widely used in the education of crisis management. Risk management and crisis management are usually not discriminated and confused. In the catastrophic neurological diseases, especially including acute coma, crisis management is not paid attention so far, unlike risk management. It will take time to discover novel treatments to improve the outcome of acute coma. However, education of citizens can rapidly improve the outcome in every country, especially including low and medium income countries. This slide summarizes that those patients at risk of disorders of consciousness. Important one is described in red letter. And for example, alcohol, heavy drinker is at risk. And not only the current one, but also past drinker have some kind of risk for disorders of consciousness. And stroke, especially hemorrhagic, and epilepsy and seizure of not only convulsive but also non-convulsive ones also risks. And dementia and brain tumor and atrial fibrillation, aged malnutrition, sleep apnea syndrome, and those with past DOCs, those taking critical medications. This slide summarizes the education of preparedness for DOC. Stairs top and those places cannot be easily found should be avoided. And in cases of bathing, swimming, and super, ask family and so on to pay attention. Also avoid rapid temperature change, standing, long bathing. Also avoid alone in the spa. In the laboratory, need to avoid straying. Avoid excessive alcohol. And sleep shortage, overwork, excessive alcohol is also important, especially in patients with epilepsy. In terms of blood pressure, avoid excess angry, excitation, anxiety, breath hold. Also, should be lateral neck need to be avoid pressing, massage. This slide summarizes momentary self-response to acute DOC. For example, move to safer and better foundable place. In the bath, turn off the switch and uncork a bath bottle. And about the position, sit or crouch down rapidly. And vomit food in the mouth to avoid asphyxia and aspiration. Also, relieve symptoms of liquid are advised. This slide summarizes anything family and bystanders can do to acute DOC. Moving the patient to safer and better foundable place. Evacuate food in the mouth. CPR, especially chest compressions and AED. And evaluation, especially eyes position weakness and so on. We can make a great difference rapidly in terms of the outcomes of the catastrophic neurological diseases, especially including acute coma, by education of citizens in every country, regardless of low, medium, or high-income countries, and so on, about both risk and crisis management. Presented about the risk and crisis management of acute coma at the onset. We can make a great difference rapidly in terms of the outcomes of the catastrophic neurological disease, especially including acute coma, by education of citizens in every country, regardless of low, medium, high income countries and so on, about both risk and crisis management. Education of citizens is one of the most critical measures to enhance success of the Curing Coma campaign in every country, especially in low and medium income countries. Thank you very much for your kind attention.